What would it mean to your lifestyle, your family, your job, and your community if wellness was a top priority? If we had a future where we didn't talk about healthcare, instead we talked about health and how to maintain it. It is a huge change in the way we think, to focus on keeping you well and keeping the community healthy. Better health means better futures for our residents and families. It starts with hearing your voices, addressing your concerns, meeting your needs. Change is never easy, but we are constantly improving the system you need to be healthy. This system can only be built by all of our health service providers getting on board under a common strategy. If we accelerate system change today, working together with our health service providers in Waterloo, Wellington, we will provide our residents the right care at the right place at the right time.
By acting in the best interests of our residents' health and well-being, we're making our communities better for generations to come. The LHINs were created in 2006 to improve healthcare systems at the local level. We know that an integrated system creates better access to care, a better patient experience, and better value for money.
Integration in healthcare refers to services or service providers coming together where it makes sense to help residents get better care in the most seamless way possible. The health of local residents is not just defined by access to doctors, hospitals, and medicine. It is also determined by where we live, where we work, access to good food, education, and a supportive community. Working within this greater framework, the Waterloo Wellington LHIN's role is to improve the local health system, putting your health and well-being first. We know we're moving in the right direction because we've seen substantial improvements in just the past few years. Waterloo Wellington had some of the longest wait times in the province and fewer options for local cancer and cardiac care. Today, we have some of the lowest wait times for cancer and cardiac surgery and some of the best overall cancer care results in Ontario. Many residents did not have a primary care provider. We've worked hard to recruit and retain physicians in our region and have created new family health teams and nurse practitioner clinics. Over 25% of all hospital beds were being used by patients well enough to leave but did not have the support to recover at home. As of 2012, this number has been reduced by half, allowing more people to be in their preferred surroundings and freeing beds for others who need them. Limited home support meant that frail seniors were more often destined to go to long-term care facilities after a hospital stay. Increased home care supports are allowing many more seniors to remain safely in their homes. Residents had to make dozens of calls to aid an elderly parent with meals, transportation, and adult day programs. There is a single point of access for over 30 community support service agencies, where integration continues to thrive and improve resident care. Other notable improvements can be seen through expanded mental health services, our local hospitals working within a balanced budget, and our LHIN area having the second lowest hospital mortality rate in Ontario.
I became a nurse practitioner to help people stay healthy. Reduced wait times and access to specialist services helped me do that.
I think in the past, patient care has been delayed unnecessarily, and now what we know is that urgent care is very important. Patients now get to have it locally.
The care, the nursing visits, and the personal support worker care is pretty important.
We've seen how working together, engaging our residents, and ongoing local leadership has contributed to a more sustainable and high-quality health system, but we recognize that there's still a long way to go. Putting residents first requires strong collaboration between the LHIN, our healthcare providers, and our community. We need a collective call to action with everyone at the table working together. We've developed a plan that sets the path for improving the local health system over the next 3 years. It is the plan that we and all of our health service providers will carry out to make sure we all have high-quality integrated care.